Hello, this is Dr. Brandi with Optimal Vitality. We are going to do our concluding podcast or session on bipolar disorder in honor of March 30th, which is National Bipolar Awareness Day. Again, if someone you know or you yourself are suffering from symptoms of bipolar disorder, please seek help. Untreated symptoms can lead to physiological distress within a person, as well as upsettedness between family structures and interpersonal relationships, and can just wreak havoc on the ability to happy and healthily live lives. So if you or someone you know suffers from symptoms, please reach out and talk to someone, even if it's not us, although if it's us, it would be much better. And we can talk about treatment options. So some of those treatment options, let's kind of talk about that. The first line of treatment is mood stabilizing medications. So mood stabilizing medications are exactly what they sound like, right? They are medications that are designed to impact the neurotransmitters involved with bipolar disorder, and particularly serotonin, dopamine, and norepinephrine, okay? Amongst other ones like GABA and glutamate. So they essentially regulate the absorption or uptake and reuptake of these neurotransmitters so that somebody is living a much more stable and healthy life. Now, in the past, or how a lot of these medications were originally designed, were medications that were frontliners for treating seizure disorders. However, what we found was within different dose ranges, oftentimes they are better at treating mood instability. These medications can include, but are not limited to, Lamictal, lithium, Depakote, which is also known as valproic acid, and gabapentin. These medications can be, like I said, very beneficial in treating mood instability and helping somebody kind of even those things out, and particularly with only one medication without having to use additional ones. So that's one type of treatment. Another type of treatment is a antipsychotic medication. So what does this mean? It just means that some of the more intense symptoms, particularly symptoms associated with mania, such as hallucinations and delusions, are better targeted with the medication that is considered an antipsychotic. And again, these medications predominantly target dopamine, norepinephrine, and some of the serotonin. Antipsychotic medications can be used by themselves in treatment, or they can be used adjunct in treatment, particularly when somebody is experiencing some of those more intense symptoms, and then as they stabilize out, antipsychotic medication can be discontinued. Some of the other symptoms that we see with bipolar disorder can be a heightened level of anxiety or intense arousal. Sometimes those types of issues can be treated with anti-anxiety medicines or anxiolytic medicines. So what kind of medicines are these? Well, again, gabapentin can be a great medicine for anxiety. Benzodiazepine medications can also be used to help with anxiety, and those kind of medications are Xanax and Ativan, clonazepam, as well as additional medications that are a little bit more of a alpha agonist, which is like clonidine or guanfacine, or medications that are designed kind of more along the lines of impacting serotonin and norepinephrine, such as Buspar. When somebody's having some of the more difficulties with sleep, we might prescribe some medications to help with sleep. Medications like this can include trazodone, which impacts norepinephrine and dopamine, as well as serotonin. And we can also use sleep-aiding medication, such as Ambien, as well as some of the benzodiazepines that we previously talked about, and additionally some other medicines. Medications that we're using to treat additional symptoms, such as the anxiety or inability to sleep, we oftentimes try to use like we would the antipsychotic medicine. We use it in the beginning to help even somebody out and stabilize out some of those additional symptoms that are very intense and impactful in the beginning, with the hope that as somebody starts to stabilize, we can slowly decrease those medicines and use them not at all. or on an as-needed basis. Again, everyone is individualistic, and some of these things may or may not apply, but that is in general how those medications are used. One of the last types of medications that we might use, and again, we use this as needed in terms of where somebody's at for energy level, are stimulating medicines such as NDRI medications that impact norepinephrine and dopamine, and then a little bit of serotonin. These types of medications might include Wellbutrin or Strattera, or sometimes you'll see stimulants be used such as Adderall. And the idea is for people when they're experiencing the lethargy and the lack of energy with the depression, these medicines help give them that extra bit of oomph to kind of get going. And again, as needed, these medicines are decreased or weaned off of as somebody starts to stabilize out. So I'm sure you're concerned about the side effects of these medications, as you should be. Let's talk about the general side effects that can occur with all medications, but particularly medications associated with mental health. So one of the biggest side effects that most people complain about is upset stomach, nausea, diarrhea, things like that, right? Well, do you know why? Here is an interesting tidbit of information. You actually have the most serotonin receptors in your GI tract. That is why we get pleasure from food and upset stomach from the medication, right? Or upset stomach when we're nervous because of those serotonin receptors. So that's one. Two is essentially headaches, a little bit of blurred vision, maybe some drowsiness. Those are some of the more neurologically based side effects that somebody might have. And then the third, involving those neurotransmitters in the different areas of the brain that maybe are not targeted by the medication because they're not necessarily associated with the disorder, but we can't really control how they're uptake. So, for example, dopamine, right? Some of the medications that we give, the mood stabilizers, the antipsychotic medications, are really important to help regulate dopamine in the frontal lobe, right? So, when we're having too much dopamine, we're having the hallucinations and the delusions, right? So one of the things we try to do is give medications that are going to help bring down the levels of dopamine up here. Unfortunately, we're not always great about only targeting this area, and sometimes we impact dopamine in the inner structures of the brain where the basal ganglia is and the substantia nigra. What does that mean? Well, it essentially means that's where you're going to see some of the physiological aspects of the side effects. So that can be a little bit of tremors in the hand, maybe some restlessness in the legs. Sometimes people will grind their teeth or they'll lick their lips a lot. In excessive situations, those are considered EPS symptoms or tardive dyskinesia. Now, oftentimes these symptoms are very easily taken care of, or these side effects. However, we do want to monitor for them because they can really impact somebody's quality of life, both on an acute basis as well as if they aren't treated longitudinally. Now, just so you know, those types of symptoms are much more rare, and especially longitudinally. Sometimes people might have them to start with, but usually, like anything else, once the symptoms, like when somebody's been on the medication and it's built up in the body, those symptoms start to decrease. Individualistic treatments and symptoms we can discuss further. You can discuss further with your provider, but this is just a little bit of a general idea. And again, these side effects are not often longitudinal. They are very easily dealt with or overcome the more time somebody is on medication. And it is important to note that because they are easily overcome, it is worth talking to somebody about treatment. In the beginning, can it be unpleasant? Sure. I'm not going to sit there and say that it won't, but it is extremely difficult to live with, especially uncontrolled.